Well, thank you so much for having me here. I feel a little unusual not being a doctor standing up here, but it's fantastic to be here at the University of Washington. I really do think that the Lancet Commission is a landmark report for our time, and mental health is very clearly, currently and becoming even more so, one of the defining issues of our time. I'm not going to go through the current state of play of what's happening around the world. We've heard a lot about that already, but just a couple of things I wanted to open with before we go through the Lancet Commission itself and introduce Dr. Saxena to do that. I think the first thing is to just remind us all that this is a human and a very personal issue. As we've heard, this impacts 1 in 4 of us directly, but all of us indirectly. Just a quick show of hands if you yourself or someone you love has suffered from a mental health condition. It's every single person in the room, including myself. So I've suffered from PTSD and depression 5 years ago after a trauma, and as we've heard, there are treatments. I recovered, and I'm living a very full life these days. But globally, we do face serious human rights abuses. For those that are suffering, the vast majority receive no support at all. Especially in low middle income countries where most of these conditions occur, and a lot lose their lives. It really is time to act, and we have so much to build on. What I wanted to do was to just really briefly, what I was asked to do is give a bit of an update of what's happening in the global, almost the political economy of mental health and the movement that really is building. And to help with some of this, a little bit of context as to why I'm here. Just over 12 months ago, after my recovery, I just finished running the mental health campaign for Their Royal Highnesses, the Duke and Duchess of Cambridge and Prince Harry in England. The Heads Together campaign was a really wonderful campaign that brought together campaigners and advocates right across the United Kingdom that put mental health to the top of the public agenda. And we saw how through galvanizing our voices together, by coming together with this united vision, a huge amount of action has been taken. And as I was sitting there reflecting on this campaign at Kensington Palace one night, very strangely, I picked up a report from the Institute of Health Metrics and Evaluation. And as I was wondering about what is the global situation on mental health, and was absolutely shocked by what I saw. Both the burden, which is something you don't hear about, even having worked in global campaigning, and secondly, the level of financing. So as we've heard, the incredible, wonderful efforts on HIV, maternal child health that have galvanized a lot of funding and political support. There's $13 billion, if you track, going up now into HIV globally, as there should be. Maternal child health has increased, malaria. Global financing for mental health is literally flatlining. The latest report showed a total of about $135 million to all countries of global financing, with really no major funders stepping up. But what you also have, as you've seen here at the University of Washington, really leading the way is finding solutions and supporting interventions around the world that do work. This history of work with the WHO and others that have incredible people in communities implementing things that really work. So I was like, this is very strange. There's solutions that work. There's a clear gap. Why isn't there the political momentum and the financing that's needed? And so we established United for Global Mental Health, bringing together campaigners, lived experience, advocates like myself, people who are experienced in having built things like the Global Fund, financing experts, to come and support the global mental health community and say, how can we build the level of support and resourcing that's required? So just over the last 12 months, it has been a lot of activity, which we've seen a lot happen. Right at the beginning of the year, the World Bank called a meeting to say, how do we finance mental health around the world, which kickstarted an effort which has been truly global, again, with the University of Washington at the heart of a lot of this around what needs to be funded where and how much, which we've been doing together. In May, there was a UN roundtable with the Secretary General himself and heads of agencies saying, what does the UN have to do with this? They've just launched their own mental health program for the UN itself, just this week, actually, off the back of that. In September, the first high-level meeting at the UN General Assembly with the community coming together saying it is time to act. You know, we know what works, as the Lancet Commission and others show us. We need the level of action that's needed. That was hosted by a range of governments, Canada, Belgium, Bahrain, the Netherlands, all coming together under this uniting global movement. And then most recently, just 2 weeks ago, or last week in London, the first global mental health ministerial summit, where ministers came together from countries all over the world to address this. And actually the Netherlands has committed to host the second one next year, really focusing on global mental health in conflict settings. At that summit, we've heard the Lancet Commission was launched, and it really has been marked as a seminal piece of knowledge, bringing together 28 commissioners from around the world over the last 3 years to provide this blueprint. As a group of campaigners and advocates, we think it's absolutely essential because it gives us that foundation to advocate for, and we're really looking forward to working with all the commissioners, yourselves, the voices, building the movement that's needed to get the level of action that's really needed. It's a great pleasure now. I just wanted to show you one other thing to say. This conversation on mental health, it actually lives in every one of our families in some way or another. It's already there. But to get this message around needing greater action, we have to bring this message out into the public. We can be lobbying, advocating to governments, but we also need to get it there. And so one of the things we have been doing is creating some public films. I'm going to play you one here that summarizes this, that we launched alongside the Lancet Commission launched last week. It's made by the producers of Wallace and Gromit. So it's not the usual mental health message, and voiced by Stephen Fry, who is the voice of Harry Potter, actually. But it's been scripted by many of us coming together to say, what is the joint message we want to get across as a global community? And so we're just going to play this now, and I hope it works. Maybe.
Ah, that's better. Some more light on the subject of mental health. How nice. The thing is, we all have mental health, but where and how we live shapes our well-being. And mental illness can affect you, me, or anyone. We need a new mindset. 1 in 4 of us at some point in our lives will have a mental health condition. Every 40 seconds, a person dies from suicide. And mental ill health costs the world $2.5 trillion every year. No matter where you are, mental health has been overlooked and underfunded. But we could turn all this on its head. Most mental health conditions are preventable or treatable. It's time to put mental health at the top of the agenda with the funding, research, and resources it urgently needs. Let's create a world where everyone, everywhere, has someone to turn to in support of their mental health. The effect will transform our future, our schools, our businesses, our communities, whole countries, in fact. Because if we change our attitude to mental health, we change the world.
Great. So we look forward to translating that into many languages and getting out there. If you'd like to share that, we'd love to encourage you to do so. You can find it at unitedgmh.com or on social at